We've already had that notice come up that you're
I know,
recording
but it
it.
wasn't me, it's some robot who started it. I know. It's anyway, you think you're on top of technology and then anyway. Hi everyone. Thank you very much for joining us today for an exceptional GFAN slash Global Fund Secretariat call. So we are very happy to have Claudia here uh, to uh, to present the results of a survey, which is a first for the Secretariat that tried to look at where identifying who the sub and probably sub grantees of various grants were, and present us with where the money is going and who is doing what with money coming from the partnership. So without further ado, I'll leave the floor to Claudia, who will be leading the call. And thank you all very much for joining us today. Claudia, floor is yours.
Perfect. Thank you, Quentin. And I want to start by thanking GFAN for organizing this call and everyone for joining, because I know we are less than a week away from the AIDS conference, which means that everyone is running around hectically preparing. Really appreciate the time for everyone to join this call. What I'm going to present to you today is still under embargo. We're going to officially launch it in Munich in the AIDS conference. But because GFAN and everyone here is so central to the Global Funds partnership, and of course you have also been the ones asking for this data, we wanted to give you a sneak peek of what we're going to be sharing there. So what we have done essentially is we have done, for the first time ever, an analysis of what funding from country grant money actually goes to civil society and communities. And what you see here on this slide is a number of reasons of why we've done it. But I would say the most important is you have been asking for this for years. No, the civil society delegations and the community delegations for the board have been asking for data on funding for communities for years already. And when it comes time for replenishment, we hear this call really amplified, no? Where, fair enough, communities will say to the Global Fund, we help you mobilize resources. Do these resources actually reach the communities that they need to? And up until now, the honest answer is we did not have the data to tell you. So for the first time, we looked at the grants and essentially went through every single grant agreement for Grant Cycle 5 and Grant Cycle 6 so that we can tell you what the data looks like and hopefully give you that data to inform your advocacy and our own funding allocation efforts within the Global Fund. So what did we do? As I say, we looked through the grant agreements for 2 grant cycles. And the reason we chose to go back to Grant Cycle 5, in addition to Grant Cycle 6, is because we wanted to provide a sense of a target and a sense of a trend. So you would be able to see, are we moving in a positive direction? Is funding for communities and civil society going up, going down? What does it look like across regions? What does it look like across disease components? So we looked at those 2. We did not look at Grant Cycle 7 because, as you'll know, Grant Cycle 7 is still underway, so the data would have been necessarily incomplete. But what we do have now is a commitment to continue this sort of analysis. So we will do a similar analysis for Grant Cycle 7 when the time is right and it has been completed. And the hope, and your advocacy will help us in this, is that we will continue to do these sort of analysis moving forward and share the data in this way. And of course, we'll also be able to refine it and go into more specifics than we have here. So what we did essentially, as we looked at the grant agreements, is we went through disease components. So you'll see we have data for HIV, TB, malaria, also HIV, TB together, RSSH, and then also multi-country grants. For Grant Cycle 6 in particular, we also examined C19RM and how that funding flowed or didn't flow to communities and civil society, and then looked at grant cycle 6 with and without C19RM, because we recognize it is exceptional funding that was added to that grant cycle. And then just a note in terminology, as I talk about these findings, I'm going to be using civil society really as an umbrella term, including communities, including different local and international organizations. When, however, one looks at budget information for the Global Fund, it's important to note that the Global Fund collects data under 6 categories. So community-based organizations, local faith-based organizations, local NGOs, other community sector entities, international faith-based organizations, and international NGOs. And the relevant thing to note here in terms of a data limitation is that it is the principal recipients themselves that classify themselves, that self-identify essentially. So while here we will be presenting how much funding went to self-declared community organizations or self-declared international NGOs, we do note a limitation in that it may be that, for example, an international NGO with a country office self-declares as a community-based organization. It may be that a faith-based organization self-declares as an NGO. Those sort of things we don't know, and it is a limitation that we acknowledge in our data. Now, what did we find through the analysis? And I'll share here the top level findings, but then we'll have time to go into each of them in detail. So essentially what we see is that over the last 2 grant cycles, civil society, so including communities, local and international, manage upwards of 9 billion as principal and subrecipients of Global Fund grants. And that includes funding that was distributed through C19RM. We saw that if you look at the volume of funding for communities and civil society increased between grant cycle 5 and grant cycle 6. Though if you look at the proportion, it remained more or less steady, so a very minor increase. When you look at funding for community-based organizations, we see a doubling between grant cycle 5 and grant cycle 6. And then we found that local civil society organizations, so community-based organizations, managed an average of 57% of all civil society funding in grant cycle 5 and grant cycle 6. The conclusion that we take from this, but I'll be interested to hear the perspectives from everyone on this call, is that with more than 30% of funding managed by civil society and an increasing trend toward funding for community-based organizations, the Global Fund is essentially delivering on its promise to put communities at the center, so moving beyond rhetoric to actually matching it with some funds. Now, for the first finding, funding for communities increased between grant cycle 5 and grant cycle 6. We see it increased in volume by 36%, but then if you look at the total amount of funding, which is another way to look at it, the message is a little bit different. Now we see that rather than the volume, the proportion remained relatively steady at 32% in GC5 and 31% in GC6. And this, what the 30% number is interesting for is that it could almost be used as a sort of target. No, we should not see funding for GC7 or other grant cycles go below 30%. Now, when it comes to GC6 in particular, COVID-19 funding was added. So it essentially increased grant cycle 6 funding by 3.75 billion. And from that, civil society organizations implemented 23% of that funding. Essentially what that means is that when it comes to C19RM funding, civil society managed a smaller proportion of funding than if one looks at grant cycle 5 and grant cycle 6. Now, if one removes C19RM funding from the analysis because it is exceptional to grant cycle 6, then we see that civil society managed upwards of 32% of grant cycle 6 funding, and then upwards again of 32% with a very small variance for grant cycle 5, so remaining more or less steady when it comes to the proportion. Now, one of the interesting and reassuring findings that we had is that funding for communities increased across all health components between grant cycle 6 and grant cycle 5. And the highest increases in funding for country grants for civil society and communities focused on malaria and then combined TB, HIV. The variance, though, in the percentages of funding managed directly by civil society varied importantly across regions. So we see, for example, in this graph that civil society in West and Central Africa led on the implementation of 42% of all civil society funding and managed 47% of all Global Fund resources across both grant cycle 5 and grant cycle 6. But however, if one looks at civil societies in Southern and Eastern Africa, that percentage is lower. It's 24.5% of all civil society funding, with an average of 18.2% of the funding in the whole region. For South and Southeast Asia and the Pacific, it's 23.9% of all civil society funding, and then an average of just over 38% of all the funding in the region. Then, if we look at Latin America and the Caribbean and Eastern Europe and Central Asia, both regions received much less funding, as we're all well aware of. But the good news is that the civil society in the region manage higher proportions of the funding that is available to those two regions. So 47% and upwards of 34% respectively. There are, however, important differences between countries when it comes to the distribution and leadership in the implementation of country grants. So there are some countries, such as the DRC, Nigeria, and South Africa, where the percentage of funding managed by civil society is upwards of 30%. Then there are, if one looks at the table here on the slide, what you're seeing there is essentially the top 10 countries where civil society manages the largest amount of funds. When we were reflecting on kind of what would be desirable, what is a good example of management of funds by civil society, we essentially looked at countries that would represent the partnership that the Global Fund is. So we're not looking for countries where all or even the majority of funding is managed by civil society, because where that happens, for example, in Eastern Europe, that tends to be because governments have walked away and have left severe gaps, particularly when it comes to key populations. So that's not a good example of the partnership. If we look at countries, however, like South Africa, where civil society manages upwards of 30%, and then government and private sector manage the remaining share, that is what we would consider a good example, not only because civil society manages upwards of 30% of the funding, but also because of the sort of civil society that manages that funding. So it's not one group, it's not one community, but rather a real diversity, including women, key populations, sex workers, youth. It's a good diversity, which is what we want to see in the partnership. Now, we also saw that, there were different funding across, it's getting frozen on my end. So different community organizations manage funding across regions. So if we look at local organizations, which under the Global Fund definitions would include local NGOs, local faith-based organization, community-based organizations, and other community sector partners, managed an average of 57% of all civil society funding. So this was a very positive finding for us because we're looking to make sure that the funding is flowing directly to communities in country. More funding went to local than international organizations in all of the regions where the Global Fund is present, with the exceptions being West and Central Africa and the Middle East and North Africa. So good to again reflect on those two regions where the funding is not flowing as well to community-based organizations when we think of next steps with our advocacy. Then when it comes to disease components, local community organizations managed more funding than international organizations across all disease components, except for malaria and RSSH in GC5, and then for malaria and GC6. So again, a point for discussion and potential advocacy when it comes to community ownership of funding management for malaria. Okay. Then funding for community organizations more than doubled between GC5 and GC6. And again, this was a significant finding because we are seeing the funding remain more or less steady with a slight increase for civil society, but it is shifting. No, it is shifting towards community-based local organizations rather than big international NGOs. And we see this increase across all funding components. And the biggest increase that we see are in grants focused either on HIV or on TB HIV. But even for the other disease components, there is an increase, even if slighter. The other element that we'll look up, and I'll move to close, but after this so that we can have time for discussion, is we looked at the multi-country grants. And of course, you will know better than I that multi-country grants, especially for regions that have less eligibility for Global Fund grants, are a key opportunity to mobilize funds for the regions and to access funding for communities and especially for key populations. And our data analysis really reaffirmed this. We saw that funding to civil society organizations through country grants was upwards of 35% across both Grant Cycle 5 and Grant Cycle 6. And the 4 multi-country grants in GC5 and GC6 were managed by international NGOs with a real focus on HIV key populations. So while the funding went to a mix of international, local NGOs, and community-based organizations, what we found through the data analysis is that it proved to be an effective way to get funding to key populations in these regions. So in conclusion, what we found is that with more than 30% of funding for grant cycles 5 and 6 managed by civil society organization, and a substantive, more than doubling increase of funding towards community-based organization, the Global Fund is delivering on this promise to put communities at the center. We have the unique ability to get funding to civil society and countries, and the dual track financing model is effective. That said, none of this can be taken for granted. We know that we're at a particularly challenging time, and as funding decreases, there tend to be things that go first, no? Investments in civil society, investments in human rights, in gender, in key populations, and most marginalized groups. So the fact that we have this data and this level of investment in GC5 and GC6 does not necessarily mean that it will stay that way, no? So that's part of why we wanted to already share this data with you ahead of Munich, ahead of also the 8th replenishment, so that as advocates, you can consider how do you want to use the data to inform your efforts, and you can also tell us what other data would be useful for you in your advocacy efforts. I want to just close by thanking the developing NGOs country delegation, developed NGOs country delegation, and the communities delegation for their advocacy on this, because they have been calling for this data for years and years. And I know it sometimes feels like people aren't listening, but it made a difference. And the fact that the delegations were calling on the Secretariat to provide this data really helped us make the case for needing to do this analysis. Now that we know how to do it, it will hopefully become much more systematic. And we are also going to be sharing probably over the next month or so, a 2-pager that will take you step by step into how you can do this sort of analysis yourself. Because once you know how to do it, it's not too complex. It's just information that is quite hidden on the website. So we're going to do a how-to accompany, of course, the full analysis, which we will be sharing over the GFAN listserv later today. Let me stop there and open it up for questions. Quintan, are you happy to facilitate that?
Yeah. And
Wonderful,
I
thank you.
do want to point to Katie's message in the chat and remind everyone to please use the raise hand function. And thanks, Mick, for showing us the way. And if you prefer writing, just please write in the chat. And don't take too long. I'm sure there'll be quite a few questions, and we have plenty of time thanks to a very short and focused presentation by Claudia. So we're going to open with the first 2 hands raised. So Mick, then Sonal, and then there's one question from Gemma in the chat. We can take those 3 to start with, and then we'll get back to your room. Go ahead, Mick.
Yeah, thank you. I'm sorry, Claudia, that you're the one presenting this, but what you've presented is a crock of shit, quite frankly, and it's extremely dangerous, this report that you've just presented. And it's a manipulation of the data to present a positive picture of Global Fund support for communities and civil society. But it is also a distorted and inaccurate picture of the reality. And just to back that up, your list of 10 countries, I went through who are the PRs in those 10 countries. In Congo, it's the Ministry of Health, and I don't know who Sanru Asbi is, but that's who they are. In Nigeria, it's Catholic Relief Services, and then the rest are human virology, government, and national and government departments. In South Africa, it's AIDS Foundation, and then Beyond Zero, who have 1,000 employees. 1,000 employees. That's not a community organization. That's a massive NGO. In India, it's the Alliance India and Plan International, international NGOs. In Mozambique, it's World Vision, international NGO. In Philippines, it's 2 private foundations, not civil society, not community. In Kenya, it's AMREF and Kenya Red Cross, international NGOs. In Central African Republic, it's the Red Cross and World Vision, international NGOs. The only ones that are even remotely community is Ukraine, with the all-Ukrainian network of people living with HIV. The rest are international NGOs. So that makes a nonsense of that 10 list for a start. And just finally, slide 4, when you call international faith-based organizations and international NGOs, civil society and community, that is a complete misrepresentation. That's a misrepresentation. And because you do not track community-led, this means once again that key populations are going to be left out. On slide 5, the Global Fund is definitely not delivering on its commitment in the strategy. And that is clear because funding is not filtering down to community-led organizations. And that is clear. And that's indisputable. In slide 6, you distort the reality because how can you classify communities and civil society as the same? Because they're not. And that's what this report does. And finally, in slide 8, RSSH funding is actually almost exclusively government and shouldn't even be in the report. Civil society don't see any of that money. And CSS funding has virtually disappeared. So just to finally say, Implementing governments, this is why it's a dangerous report. Implementing governments are already saying that civil society and communities get too much money. And they're using this report and this kind of analysis from the Global Fund to back that argument up. It's appalling what the Global Fund is presenting as communities and civil society. And you need to have a good, serious look at yourselves. Thanks.
Thanks, Mick. It's always a pleasure. But very good. I mean, I think it's a good start for the conversation. We'll still go with Sonal and Gemma, and then circle back to Claudia.
Thank you. Hi, Claudia. I again start by saying thank you, because we are asking for this for years and years and years. And I'm afraid I am going to agree with what has just been said. This is too dangerous. We are actually agreeing to, I hesitate saying this because you have been a friend of community, but lies of Global Fund. If we just take out UN from that data, because UNDP is the largest PR, the numbers will go half. If we take out the international organizations, the number will go probably in decimals. In India, for example, from 5 to 6 community-based organizations have decreased because they started taking out the networks, and the PRs, the plans, and the international organizations have started implementing directly. So actually it is the other way around rather than what you are presenting. And I'm also very afraid that this is a very wrong analysis, and governments will use this to shut the community and civil society. And that is most dangerous. It is a long-lasting damage the Global Fund might do. In India, Global Fund is the only now opportunity where civil society can get money because of the Foreign Currency Act. In that also, larger organizations are opening their offices all around the country, implementing directly, and local organizations are cut off. If you tell, it is not difficult to get this analysis. Communities can give you this analysis. If you want, we can prepare a shadow report of the same 2 cycles. This is too dangerous. Please don't give it up, given to the what Global Fund is trying to feed. I completely reject this report, actually. Thank you.
Thanks, Sonal. And I want just to cover the. So we'll come back to the next two hands raised. I just wanted to take a second to read Gemma's question of an example of community organization managing funds as PRs. Network of people living with HIV in Ethiopia used to be one, but no any longer. Are there any other ones? All right, so Claudia, it's an easy Tuesday evening crowd. Go ahead.
Perfect, thank you. Let me just start by saying, Mick, because you said that you're sorry I'm the one presenting it, and no need for to be sorry, and I appreciate the candid feedback. It's why we did the analysis, so then you can give us feedback. So yeah, I really appreciate the candidness both from Mick and Sonal, even if I disagree. As the one who kind of led with other colleagues this analysis, I can assure you there has been no attempt to get any kind of particular message out. In fact, we went into the analysis thinking that the data that we would find would be much less positive. I thought, for example, that we would have findings that showed that there was very low levels of investment for certain disease components. It's not what we found. So some of the PRs that you mentioned, Mix, for example, are out of date. But in any case, just to clarify, we looked at the flows below the PR level. And then, so now just to clarify, in the kind of classification of civil society organizations and international organizations, the UN is not included, so there would not be that inflation that you refer to. That said, the way in which data is collected and kind of the distribution of categories that PRs need to self-identify with I think could be a very useful point of advocacy, because as someone who has been at the Global Fund for 2 years now, I was quite surprised to see, for example, that the categories are so broad and that faith-based is there so prominently, yet we do not have anything on people living with HIV or others affected by the diseases. We don't have a breakdown for key populations. Some of the things that one would hope to see are not there. So a potential point of advocacy, and that may help with the quality of the data. What I can tell you though now is that what we have shared today and what you'll be able to look at with kind of at your own speed and the full analysis is that it is the best available data that the Global Fund has. Let me, so what about the UN? So no, the UN is not part of this analysis, Sonal. It's, they cannot self-classify as international organizations or civil society or anything. So they're not represented at all in this. Let me stop there.
If the PRs are out of date, then the Global Fund needs to update its website, because I got those information from the Global Fund website.
Yeah, another good point of advocacy. I agree. Let me stop there though, because I see more hands.
First, because she can't raise her hand because she's host, but Katie, I think, wanted to jump in, and then we'll do to in order Linda Cooley, Leslie, and Omar.
Thanks. Yeah, and I just really quickly, you were addressing the point that I feel is, you know, sort of at the crux of the problem in terms of how this data is received, in the sense of like, there's a lived reality for people that doesn't match this data, right? And part of the reason, or an assumption at this stage about why that would be true, is because of that self-selection, right? We all know that like voluntary, voluntary self-reporting rarely ever works properly and rarely ever presents the truth. And so I'm hearing you say like these are points of advocacy, et cetera. And I think it's helpful that, you know, that you're interested in pointing out to advocates what potential advocacy points could be. But I think it would also be helpful to know how internally this report is going to be pushed, because it's not just up to us to try and push externally. A lot of the decisions around GC8 are being made now about how funding is going to be put out there, the forms, you know, the policies, et cetera. Those decisions are underway. Those discussions are happening. And it's not going to be possible for us from the external to say, revolutionize something that we've actually known has been a problem for a long time. And so as part of your conversation and as you're answering questions, Claudia, it would be really helpful for you to, you know, provide examples and sort of just share a bit of commentary about how internally this data is going to be used and when and where it's going to, you know, bring itself up in the policy discussions and not simply be presented as a accomplishment of the Global Fund, if that makes sense. So we'll pass it over to our next speakers, our next questioners. Apologies for taking a bit of time myself, but Linda, I think if you'd like to go next, and then I think we have Omar and Alana.
Thank you for the opportunity and good afternoon, everyone. I'm sorry to change my name. It's because the longer name is non-pronounceable. So this one is the better one. Okay, I am from Eswatini and I'm a
We lost you, Linda. I'm just going to mute Linda, and we'll circle back to you, and we can skip to Omar. And yeah, Omar, go ahead.
Hello, good afternoon from Omar, from the Gambia. I'm actually a member of the CCM, and I've been part of the GC7 grant request, and also a member of Stop TB KVP delegation. But I've been listening to all the presentations. So far, it seems there are so many things out of the way, because when you take my country as an example, there's absolutely nothing going on with the civil society organizations from the Global Fund. It is only the PLHIB community that have been assisted here and there with few things, but programs from the community and the civil societies are not being taken on board on the country request, and in addition by the Global Fund. We've been trying to work it out with the Gambia CCM, which I am a member of, but it's been very difficult because as a civil society representative, most of the time, all what we face from the Global Fund CCM in our country is being threatened, being scared, so that we could be there and sitting down and endorsing grants and programs, which doesn't reflect us. Whatever we put in any way will not be considered by the CCM to be forwarded to the Global Fund. We have a very big challenge in my country, and it has been like that for quite a while now. No, the data you presented doesn't reflect us at all, because for us, we understand that most of the funding in the Gambia doesn't go down to the community or the civil society organizations, because it is either blocked from one stage of the grant or request and for quite a while we've been working with the regional learning hub at ENASO and at the Stop TV partnership and other regional and global bodies, but yet still there is nothing to be done. We even is with the country portfolio manager, but at the end of the day, she was just like she doesn't care about it was like she doesn't care about what is really going on, which is really affecting the community, civil society communities and the community organizations in the Gambia, and it almost rendered them useless almost. There are some very dedicated individuals who are willing to go an extra mile to get secure some funding from partners like the British Medical Research Council in the Gambia on their community TB program, and partners like La Initiative Expertise Frances. They've been stepping in here and there, working with the communities to assist them. But from the Global Fund, absolutely, it has been a very big problem. It has been a very big challenge for the communities in the Gambia and the civil society organizations in the Gambia. I could say most of the civil society organizations from the inception of the Global Fund programs in the Gambia up to date did not have anything from the Global Fund. And most of it, after doing a thorough investigation, the civil society organizations comes together to form to sign an MOU, which will bind us together. From there, we did an investigation into the whole thing. We realized that the executive secretary of the CCM was the one manipulating everything. He was the one who decided whose priorities should be adopted, whose priorities should not be should be dropped. And we've been pushing it in every way. At the end of the day, whenever we try to push it at the CCM level, we will always get a threat. You will be removed from the CCM, you will be out of the program, and some of our vulnerable community members will be scared and move back, which is really uncomfortable. And I think the Global Fund needs to look at this very well and look into it. It is not only Gambia, it is affecting most of these our civil society organizations in our sub-region. Well, when there is a funding request, we will be asked during the country dialogue, and we will bring forward our priorities and interventions, but at the end of the day, they will be thrown out to the dustbin, just like that, which is very, very unfair to the civil society and the community organizations. I really urge the Global Fund and anybody who is responsible to look into this very well and try to find a solution to it in order to fully engage the civil society organizations and the community organizations to have an edge in the fight against TB, HIV, and malaria. Thank you very much.
Thank you, Omar. And Alana?
Hi, thank you very much. Thanks for the presentation, Claudia, and thanks for the really good discussion. I'm just thinking that I think it's wonderful that some of the classification data for the PRs is available. I think it has been for some time. I'll just note this since it's so complicated to identify who counts as community-led monitoring, who counts as community, but I think it's really essential for the subrecipient data to be made available so that communities can look at it. And as we talked about, MAGE data reports do their own analysis, but I know that this is invisible to outside of the Global Fund. And I know internally the data are quite poor. And so from an advocacy perspective, I really think this has to be an essential priority, is to make subrecipient level data available internally, and to report it consistently, and to make it public outside of the Global Fund, because it's so essential in understanding these questions. Thank you.
Oh, thanks, Helena. Claudia, do you wanna jump back in?
Sure, thank you. For me, Katie kind of hit it on the nail with how the lived reality of many communities doesn't seem to resonate with this data, and fully agree that it's not just up to advocates. Believe me, there is a lot of internal advocacy going on, and that will continue around many aspects of this. So everything from the categorization to the representation and sharing of the data to the what Alana mentions about the SR data. There are many of us internally that are well aware of the need to improve on this and are advocating for it. When I mention suggestions of what advocates may want to consider picking up on, it's really not to put it on you, but just because when we are kind of pushing from different angles, it helps. Because believe me, I can say something internally, and if it's not being echoed, it won't get the same pickup as if you are pushing. So again, even with the kind of directness and challenges to some of this data, it's actually really helpful, because then as we look to do further analysis, it gives us really good, it shows that there's a call for it, and not just a couple of us in-house that are saying, oh, this would be good to do. It is possible with data from the grant agreements to do thematic analysis. So for example, one could deeper, it's a lot of work, but it can be done. For example, to look at funding for human rights, to look at different key populations, to look at youth. I mean, you name it, you can really do it. So those will be some of the discussions that we'll be having both in-house, but also with GFAN, the delegations and other partners, to see where we want to put our focus next and what sort of analysis will be most helpful and give you the greater detail that you need. Then Omar, I think your comment again really makes me think of what Katie says about it. It's not resonating with what you're living in the Gambia. I also hear your particular challenges around the CCM. If you want to reach out bilaterally for that, I'll just drop my email in the chat and happy to discuss directly. Let me stop there because I see more hands.
Thanks, Claudia. So we have Mick, and then we have a remark from Alana in the chat, noting that the grant agreements are no longer online, but the funding request documents are. And one from Lois Maturu asking about what is the dissemination plan for the outcomes. Mick, the floor is yours.
Yeah, just a couple of things. I mean, Lois's comment in the chat about how we disseminate this, we really shouldn't disseminate this report because it's too dangerous to be disseminated. That's the first thing. And the thing is, Claudia, with the Global Fund, unless the Global Fund is going to start looking at tracking community-led and key population-led funding, and the way that funding from grants filter down to community-led and key population-led organizations, any data you produce is not going to be helpful. Now, whether that's difficult or not, the thing is, you need to start measuring how funding is actually reaching the populations that need it the most. And currently, and I'm in touch with countries constantly, and so are my colleagues in Impact, in GATE, in Input, the money is not filtering down. The support is simply not filtering down. And until you start tracking that and get a true picture, then you're always going to be out of sync. You're always going to be presenting stuff that doesn't accurately reflect the realities that our constituencies face in country on a daily basis. Over.
Thanks, Mick. I don't see any other hands. Last chance to add. Go ahead, Claudia.
Perfect, thank you. For Lois's question on dissemination, but then also so everyone can kind of know what to expect, I will share the full analysis on the GFAN listserv after this call. We will be presenting it in the GFAN networking zone in Munich. And what I would say in terms of next steps, once you have read the report, if you want to have a further discussion, please reach out. I'm happy to do so. And we can, we'll also give some further thought internally in terms of the messaging and how we can undertake print data analysis moving forward. And just seeing quickly in the chat from Peter Wiesner, a breakdown of the money to international and local NGOs that is included in the analysis. The limitation being, of course, that PRs self-identify. But that is acknowledged again in the methodology limitations. I'm not seeing any other. I think I've got all the questions from the chat.
Silent hand raised by Katie. Katie, do you want to go ahead?
Yeah, so Claudia, thanks for being clear that you're going to share the analysis over the listserv after the call, and that the information that's going to be shared, sort of, that's under embargo, and the information will be more publicly shared next week. Would you say that there's an opportunity still to adjust some of the key messaging of this report in terms of how it's released? I think that, like, I understand why there's an imperative from your end and internally to release it, but it feels to me like it would be better if the language didn't claim this as a victory, I think, is the way to, and maybe, you know, you went through your slides, there's a lot of words there. I don't know what you're writing. So maybe that's how you're doing it. But I sort of feel like if it was more like, look, this is what we can show. These are the limitations of the data currently. We know that through conversation, you know, many civil society and community activists and organizations don't really see this as, you know, the end point of the research or the end point of what the data can tell us. We're going to be working on that. We're going to continue to try and improve. It's going to need changes to how things are defined, to how policies are enacted, you know, blah, 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 blah. But, you know, it's part of the learning of the institution, as opposed to like a fait accompli. One of the pieces sort of seemed to suggest, you know, therefore, because of this data, the Global Fund is awesome at funding community and CSOs. And I think if there's an opportunity to change some of that narrative that accompanies this data, like this data is already publicly available, most of it, right? If somebody wanted to go and deep dive into the Data Explorer. And so I think what we would say to you is if there's an opportunity to change the way this is messaged and to change the way that this is presented, that would be more beneficial in the long run for us to be able to do sort of the advocacy that's needed. Because if this is presented, as I think, you know, Mick and Sonal and others have said, if this is presented as a positive in terms of how the Global Fund is, you know, great at this, that is going to be a challenge for all of us in terms of our advocacy to make changes. That's all there is to it. So that and, you know, that's my comment. More people have raised hands since I made that comment, so encouraging more discussion. But Claudia, did you want to respond to that, or should we go to the remaining questions and then one last sort of round from you?
Let me just quickly say, yes, that is possible. I think the slides that I presented today had more on kind of, let's say, celebratory language than the actual report has. In the report, we tried very hard to be factual and say this is the data and not make those sort of congratulatory statements. But we can absolutely take a last look at it and refine some of that messaging based on the feedback from today's call.
Thank you. Robin, Gaj, and Linda, and just noting we're at 8 minutes before the end of the call. Robin?
Great. Thanks, Katie and Claudia. Thanks so much for being so open to have this discussion, because I think this is really important space to have this discussion and to make suggestions about how we can improve on the advocacy around this. So 2 comments. One is building off of Katie's point, just around the limitations and really being very careful about how we use and have our advocacy strategies around this. I think one of the key messages coming out of the presentation in this discussion is really the limitations in the data, right? Perhaps if we were to focus in on that as one of the core messages, and also thread it with other existing data out there. There was an amazing DevEx article and report not too long ago, maybe a month ago, that shows actually less than 10% of international funding actually gets to communities. So, you know, if we were to cross-reference that and show that this is, as Katie said, a learning moment that deserves further investigation, then perhaps that is a way forward. The second question that I had, and I didn't hear it in the presentation, but there is a big difference between funding that reaches communities in country allocations and funding that communities receive through catalytic investments. And so we know that catalytic investments are really very community and civil society driven and focused. So if the bulk of this 30% is or higher is actually because of catalytic investments, that's an important advocacy message that we can use also to help drive more money for catalytic investments. But that is a really important distinction to make. And I'm not sure if you've been able to do that kind of analysis, but would love to hear more. Thanks. I can share the DevEx article over the GFAN web listserv. Thanks.
Thanks, Robin. Gaj, if I'm...
Thank you. Thank you, Katie, and thank you, Claudia, for the presentation. I just wanted to, provide some little bit of a data because harm reduction international, we collect funding data. I mean, it just for the harm reduction, so it may not be, kind of generalized to all the civil society funding within the Global Fund, but our data also kind of, contradicts with what's been presented right now. So firstly, I mean, for GSSX, there was a huge difficulty. So in terms of accessing data because of the changes in the modular template. So it's really, I'm glad to hear from Claudia that, the data on GSSX can also be kind of, analyzed to this level. So that is great. But within our data, so I've just very, in a sense, because of those limitations, we're not able to kind of have a very robust data, but our data on community-led organizations, including community-based organizations for 2020, it was under 10%, and for 2020 to 2022, it was merely 13%. But the indication it's actually lower than that. And also, there are other qualitative issues. For instance, Robin was also just mentioning in terms of, you could have budgets, but during the actual implementations, what we also found is that there were so many barriers when it was being implemented by the civil society. So the budget was there for the community-led organization, but it was not actually implemented. Either it has gone somewhere or it just frozen over there. But then the money actually didn't go to the ground. And there are a lot of, so we don't have the robust evidence on this, but there are lots of anecdotal that we collected during our data collections. And I'm sure its funds is also doing the similar kind of data collections on the entire key population. So perhaps it's also good once they completed their data collection, perhaps, just to have this kind of discussions in terms of, the not exactly data validation, but we could have more data level discussions as well, collected by the Global Fund and from the civil society perspective. Thank you.
Very helpful, and noting that it's Linda from the Secretariat who has her hand raised. So Claudia, maybe Linda, if you want to unmute quickly, and then Claudia, you can close us off.
Thank you. Thanks so much, Katie, and thanks everyone for the feedback, and also just being gloves of conversation, because then the feedback then helps us to refine, to review, and to also see how we shape this going forward. So I wanted to just say that in terms of the team, we will go back to the drawing board. We will have a look at the messaging. We'll have a look at the data itself, and then get back to you in terms of how do we want to then work with you on it, and how do we want to share the information. And what we are taking seriously is what we are saying in terms of the potential impact of the information if it goes out there, without us shaping it in a way that then becomes an advocacy tool. So thank you so much.
Perfect. Thank you, Linda. And I know we're almost at time. So just to respond quickly, the catalytic investments are not a focus of the analysis, but they're acknowledged to the extent that they form part of the country grant, but we can follow up more on that, Robin. I'd love to see the DevEx article that you mentioned. Then for Gaj, I think you flag a really important issue on the challenges that civil society face in actually implementing funding that they are meant to be managing. The analysis does not get into implementation. So something that we're flagging for potential future analysis. As next steps, then we're going to hold actually on sending the report right away to the listserv so that we can look at some of the messaging and language and adjust it based on the feedback that we've had on this call, and make sure that we are not I mean, the last thing we'll want to do is, of course, message it in a way that will be harmful for communities and civil society. The intent is quite the opposite. So we'll take another look at it, and then probably look at releasing in Munich. But we'll come back to you on that. And really thank you all for making the time for the call today and for the helpful feedback.
So I think the last thing to say is thank you for coming, and the call is, as what it often can be, is an open and frank exchange. Claudia, I think it's useful for us to think, as you take this messaging back, to think about both how you're going to proceed and clarify that with us so that we can share that with colleagues, and then also what further conversations there are opportunities for, not just in Munich, but also after Munich, not everybody being at the AIDS conference or being able to be at the AIDS conference. So, but thank you. And everyone, apologies that we've, sort of hit the hour. You may have to run to other calls. We're going to make sure we have the chat from today so that we'll keep an eye to those questions, and just, thank you everyone for being here and for having this important discussion. And we do look forward to seeing how that helps to shape the next steps, Claudia and Linda. So thanks very much for that.
Perfect. Thank you, everyone.
Take care,
Bye.
everybody. Good rest of your days.
Thanks, everybody. Thanks, GFAN.
Bye, everyone. Thanks a lot for today.